Welcome to our MRSA website. I'm Dr. Robert Dahm. I'm here to talk about Staphylococcus aureus. Staphylococcus aureus is the commonest isolate today from patients and human beings in a medical kind of setting. It's an organism that probably lives on somewhere in our bodies about a quarter to even up to half of the time. So many of us are colonized with this organism, never even know it. The problem, of course, is that sometimes it's not so friendly. And even though it lives in what we call an asymptomatic way on our bodies, it can occasionally turn on us and cause a nasty disease. These diseases can range from very mild infections of a fingernail to a little bit of local skin infection, all the way to a very serious invasive disease which put people in the hospital and sometimes even cause fatal illness. Methicillin resistance is a term that is frequently applied to a subset of the members of this species, Staphylococcus aureus. Methicillin refers to an antibiotic that we don't even use anymore. It's an archaic antibiotic, but the term methicillin resistance, or MRSA, methicillin resistant Staphylococcus aureus, implies resistance to all beta-lactam antibiotics. That means all penicillins, all cephalosporins. Obviously, the advent of MRSA organisms has caused doctors and healthcare providers to have to rethink how they treat infections caused by MRSA. We are living in a country here in the U.S. that has had an epidemic of MRSA disease, and it's now a decade old. MRSA used to be a problem only with people who frequented healthcare environments. That patients with chronic disease, patients who needed to go to the doctor a lot, experienced MRSA infections from time to time, but healthy people living in the community did not. That situation changed about a decade ago when new strains of MRSA emerged and have spread in a very facile way through the community. This has caused us to have an epidemic of community-associated MRSA disease. The recognition of this epidemic has put new pressure on healthcare providers to understand the epidemiology, to understand how these new community MRSA strains spread from person to person, to create new ideas about how to treat them, and also to think about how to prevent them, say with a vaccine. We like to think that, we like to couch the epidemic in terms of thinking that this is right around the end of the first decade of it. And we've been trying mightily, as have many other groups, to do the research necessary to understand the new epidemiology and the new molecular biology of these community MRSA strains. That is to say, what's changed? Why is this happening? Why do they seem so transmissible? And why do they seem so virulent? In terms of understanding it, we are doing research, and research, unfortunately, costs money to perform. And so resources were not easily forthcoming from the public agencies like NIH and CDC that are charged with supporting efforts like this, because they initially thought that things hadn't really changed, that these were perhaps the healthcare associated strains migrating out into the community, that it didn't seem to be an enormous problem. I think they're on board now in the last 5 years or so with the idea that that view has to be revised, and that we do now understand that MRSA infections in the community have increased dramatically, that the overall problem of MRSA is now a public health imperative, and that an enormous amount of research, which unfortunately is going to cost money, needs to be done to understand how this is happening, why, and then quickly develop strategies to control it. So this is an ongoing work in progress, I guess, and I think it's coming up to speed now. We really feel the change. It's improved, but we need more support, and there's a long way to go to get to the level of really feeling like we could solve the problem. There are many things, as you look around the website at the various things that we have here for you to see, that there's much known about this community-associated MRSA epidemic, but there's a great deal that we don't know. This is a topic of ongoing intense research to try to fill in the many gaps that we have to understand it. We hope you will benefit from looking around and ask questions of yourself and of us, and that we can quickly work together to stop this epidemic from spreading further.